Hello, and welcome to Population Health Weekly. Today, we are going to be talking about the College of Health and our faculty research and some of the experiential learning opportunities that you will have when you come here as a student. My name is Whitney Witt, and I am the Dean of the College of Health. And I'm very excited to be joined by my esteemed colleagues who will serve as panelists and share their research with you all today. Dr. Hal Skinner, who is an Associate Dean for Research and an Associate Professor. Dr. Hyuk Choi, who's an Associate Professor. Dr. Ed Gomez, who's also an Associate Professor, and Dr. Fatima Wakil, who's an Associate Professor. So welcome everyone, and we're so glad you could join us today and hear about the exciting work that's going on in the College of Health and why we think that you would be a great addition to the College of Health team. So, so let's just talk a little bit about what we're going to do today. So I'm going to introduce the panelists. They are going to showcase their research and actually show you some of the data. And then we're going to just talk about why Lehigh, why the College of Health, why is it so unique, what makes it so exciting and cutting edge. So we'll wrap everything up at the end by having a really nice discussion about that. So without further ado, let's introduce the College of Health faculty. As I mentioned, I'm Dr. Whitney Witt, the inaugural dean. I also would like to introduce Dr. Hal Skinner, and today he's going to be talking with us about tracking COVID-19 over time. Dr. Hyuk Choi will be talking with us about global environmental impact of what we eat. Dr. Ed Gomez is going to talk to us about global childhood obesity and the politics and policy around those outcomes. And Dr. Fatima Wakil will talk with us about racial and ethnic disparities in maternal and child health. So we have a really amazing panel today, and couldn't be more excited to get started. So next slide, please. So I will tell you a little bit about what I have been doing. Next slide, please. So a lot of my work, I'm trained in health policy and management, and a lot of my work has focused on healthcare costs as it relates to chronic conditions. And one of the things I wanted to show you actually was a graph. So this is a graph, next slide, of the US and compared to a number of OECD countries in terms of healthcare spending per person by life expectancy. And what you can see is that over time, the amount of money that the US has spent on healthcare has increased with really no benefit or little benefit to life expectancies. And particularly compared to our OECD counterpart. Next slide, please. The other thing that you all will be able to learn about is artificial intelligence and how to develop tools to improve health outcomes. When I was at IBM before coming here, I had the opportunity to develop a tool that was really exciting. It brought in disparate forms of data, vital signs. It brought in unstructured patient data from clinician notes. We included actual speech and used natural language processing to bring in those data. And essentially, all of this was informed by guidelines and protocols, recommendations from different providers. So we essentially created a dashboard with early warning scores to enable clinical teams to take preemptive action for patients at high risk. And also to promote effective communication and synchronized operations to ensure critical information is sent directly to the team members. And then smart alarms and decision support, question and answering, abilities to get quick answers on, really, important decisions that have to be made immediately. And then also in terms of risk assessment and data making, that's a real key advantage to using these data. And then the other example I wanted to give you was a cognitive-based predictive risk modeling tool that we developed to improve early identification of individuals who are at risk for adverse health outcomes. The tool incorporates an interactive, easy-to-use dashboard showing key information such as risk scores. So, it would allow us to identify high-risk individuals for prevention interventions and timely and appropriate treatment. Real-time decision-making for high-risk individuals. These are people who are going to need assistance and follow-up. Consistency and standardization across decision makers regarding screening and treatment for public health issues. We couldn't see more of that coming out right now with the COVID-19 pandemic. So these are a few examples of the kinds of projects and products and research that I've done over the last 25 years that really informs my vision for the College of Health. And I couldn't be more excited to be here. So my areas of research are value-based payment reform, health innovation and technology, and maternal and child health. So I'm now going to turn it over to Dr. Hal Skinner, who's going to talk with us today about tracking COVID-19 over time. Dr. Skinner.
Thank you very much, Dean Witt. It's great to be here, and it's great to see all of the attendees joining and have an opportunity to talk with you on the cusp of your final decision, which we hope will be to join us for a really great and exciting time this fall. As Dean Witt mentioned, I'm the Associate Dean for Research and an Associate Professor, but important information for you to have is that I'm also an epidemiologist. And a lot of our work and focus of attention has been around this recent pandemic and coming up with ways that we think we can be helpful in thinking about it and being informative about it. Could I have the next slide? So you've seen probably a lot of figures looking at the rise of cases or the rise of mortality and the recent plateau in case counts per day and the recent plateau in mortality per day. And one of the things that we've been interested in thinking about is how testing has been playing into our understanding of the number of cases per day and how that plays into decisions about policies to either close down or open up society and businesses as we try and address the challenges that a pandemic faces. This is a figure that I put together a few days ago, looking at each state in the United States, including US territories. And along the x-axis, we're looking across time to see how things changed over time. And on the y-axis, we're looking at the percent of tests that were done for COVID-19 that turned out to be positive. And if you just take a big picture look at everything and kind of get a snapshot view of what's going on, you see that there are some different patterns. That some states have very high peaks. Some states have big drop-offs. Other states are relatively flat and low. And other states are sort of a hybrid. There's a peak here and then an incline there. Sometimes we create figures to answer questions, and sometimes we create figures to help us figure out which questions we want to ask. And this is one of those types of figures. So there are a lot of interesting questions that we can be asking about testing policy in the United States. why do these states have different patterns of testing increase? So for example, Delaware, which is near the top right corner, DE, you can see had a sharp peak and then a sharp decline. The sharp decline happened when they started to get enough tests available to cover at least the people they had coming into the hospitals, the symptoms for testing. And that same pattern is repeated across many other states. So this is sort of example of the type of exploratory data analysis that we're interested in doing here in the College of Health. And now that we have kind of a picture of what the testing situation looks like, and we know that testing will be increasing, we're going to start shifting some of our attention to thinking about syndromic surveillance. That is, looking at symptoms that occur over time to be able to detect if there's an early rise in cases that are coming, perhaps with new cases or a later stage of a rise in the outbreak. This is one of the many tools that you'll be learning about developing and how to use, these sort of data visualizations. This is sort of one segment of the type of information that you can be working with and will be working with us here at the College of Health. If I could have the next slide. More broadly speaking, my research areas sort of fall into two big categories. One of them is Lehigh Initiatives, and this is really more about building research resources that can be shared within the College of Health and across the university and with our external partners that will help us be ready to answer questions rapidly and with high quality. These include the Population Health Data Warehouse, a biospecimen repository to look at biological markers of disease progression and health status. This is sort of in quotes because it's a generic description of a cohort study that we're developing, and we're very excited about it, but we're not quite ready to share all the details of it. And then again, some really exciting new work that just, of course, popped up because of the situation with COVID-19. It is developing systems for syndromic surveillance, and that's stitching together data resources from across a huge range of options to try and get the most up-to-date information about when people might be getting sick. More generally speaking, my past research has been around genetic and molecular models of cancer risk and progression. That's an area where I still have strong interest. Health and healthcare quality measurement. This is a really important, a crucial piece of understanding how we can get better value from health and healthcare, how we can maybe pay less for better outcomes, to the point that Dr. Witt was making. I'm also interested in developing and using modern causal inference methods. That's sort of an advanced topic that we'll get into later in the program about how to use observational data in smart ways to say real things about what's happening in cause and effect in health and healthcare. And then I also have a broad interest in tech tools for population health, ways that we can recruit participants or track participants or get information from people to better create a valid and reliable data set and with greater efficiency and hopefully lower cost and higher quality. So with that, I look forward to talking with you a little bit later.
Oh, thank you so much, Dr. Skinner. That was great. Really, really appreciate you know, all the amazing resources you're developing and you're sharing your program of research. I'm really pleased to introduce Dr. Ed Gomez. He's an associate professor here in the College of Health, and he's going to talk to us about global childhood obesity and the politics and the policy around that. Dr. Gomez, welcome.
Great, thank you very much, Dean Witten. Thank you all of you for taking the time today. I'm very excited that you've applied and will possibly be joining us this fall. And it's a great, exciting time for you to be joining us. There's amazing faculty here doing exciting research. And so what I thought I'd do is go over a little bit about my current project, book project called Junk Food Politics, which is under book contract with Johns Hopkins University Press. And this book talks about the global obesity epidemic, as well as diabetes among vulnerable populations, focusing specifically on children, but also the poor populations in emerging economies like Brazil, India, Indonesia, China, Mexico. And so, and then I'll talk a bit about what my other research interests are, what some classes you could probably take me, some classes that you could take from me in talking about these issues, and then some other methodological issues that I do in my research. So the current book project that I'm working on is looking at obesity prevalence on girls and boys and adolescent ages in emerging economies. And this is, the growth of obesity among children has burgeoned in recent years, having to do with nutrition transition in a lot of these countries. Looking at changes in sedentary lifestyle, technology, and how more children are watching more TV, not playing outside as much. There's also a lot of environmental issues in terms of child safety, running outside in polluted areas, or not have access to parks. So in a lot of countries, we've seen in the past 20 years a huge surge in the number of adolescents that are overweight and obese. And you can see here from this chart, the number of girls at the top, and the red colored countries are seeing the highest level of obesity. And below here, slide B, you have boys that are obese. And in both cases, you see the US, of course, being high, and then followed by other countries like Mexico, Argentina. For boys, China is very high, Australia and Europe. And so in this book, it looks at provides a different perspective. It looks at the role of interest groups and corporations and their ability to continuously manipulate policies such as a soda tax or prevention programs in their favor through not only your traditional bribes, but a host of other political activities that these industries are doing, such as working closely with communities, working closely with mothers and providing employment programs, educational partnerships with schools, and a host of other activities. And what's interesting is that this research is showing that industries are targeting these emerging economies and becoming more political in what they're doing and how they're working with not only communities, but legislators, and trying to be perceived as a solution to the problem, when we all know that they are also contributing to the problem. We had an interesting discussion last week with McDonald's and sort of their impact. Well, one of the countries that I'm working on right now, book chapter, is China, where McDonald's and KFC has been highly prevalent and has grown more so than in the US in terms of the number of franchises that are being opened. And so, this is an opportunity for you to possibly join me in this research. If we go on the next slide, please. Some of the topics that you could possibly work with me on are, for example, looking at how political science, interest group, institutional theory can explain how these industries continue to obstruct policy. Another area that we could work on is exploring the new political tactics, as I mentioned earlier, some industries have in influencing policy in these countries. But also, I'm very much interested in the role of civil society. And in this project, I compare the role of activists and communities in confronting these big industries and working with supportive government officials and trying to thwart their influence. And for example, Mexico, where I've spending a lot of time recently in the past couple of years, their activists, as I talked about, have been the most successful in not only introducing soda tax, but also recently introducing new label innovations and making labels more effective in informing consumers about what they're consuming. Another area we can look at is how all this research translates to new policy recommendations with the focus on regulating industry. In 2005, the leader of the World Health Organization, Margaret Chan, from China, made a tremendous speech in which she said that countries in the emerging economies and developing countries have been afraid to tackle big companies and big industry through regulations. And so one lesson that we could use, or what devise from this research, is what new regulatory policies countries need to adopt to ensure that their most vulnerable populations are protected from obesity, diabetes, and these health ailments. And now we're seeing with COVID-19 a high level of incidence of deaths for people that are obese or overweight. So this also dovetails with the risks involved in death rates from these diseases in COVID-19. Some classes that you could possibly take with me in this area, of course, I'll be teaching the history of population health, and we'll be talking about some of these issues in that class from a historical perspective, but looking at the end at some contemporary challenges that we must overcome, looking at historical institutions and regulations and obesity and population health and these emerging economies, but also comparing these countries to the US facing similar kinds of challenges. And methodology that I usually take, historically, I've been doing more qualitative research methods, looking at comparative case study design. I've taught classes on that issue in the past, and qualitative methodology for field research and case study selection. But I've also done mixed methodology, combining case studies with cross-national statistics. So I have some papers that I look at looking at cross-national obesity prevention programs and looking at qualitative case studies like the US, Brazil, and testing out these cross-national statistical findings with in-depth case studies. So I'm very much interested in exploring how we can combine both quantitative and qualitative data. And the research that I mentioned recently with the work I'm doing now is more qualitative focused, but I'm also interested in working with students on integrating statistical methods into their own case studies. And so other projects that I'm working on very quickly, I'm working on malnutrition and poverty and with colleagues in Indonesia. We have a project that's been going on there for 2 or 3 years, a grant project. I'm working with colleagues in Mexico, the National Institute of Public Health, on type 2 diabetes. So we've had a project there and research that we've been doing for a couple of years and looking at institutions and governance in type 2 diabetes in Mexico, which leads the world next to China and India on the prevalence of type 2 diabetes. And I'm also working on international organizations and how the World Bank and the Global Fund to fight AIDS, tuberculosis, malaria, and other international organizations are working with civil society to address ongoing population health issues in their countries. So that's some of the research that I do, and I look forward to possibly working with some of you on these exciting topics. Thank you very much.
Thank you, Dr. Gomez. Just really so impressive, not only the substantive work that you've done, but also, you've contributed in some very meaningful ways methodologically to the field of health politics and policy. So thank you for sharing that. I'm very pleased to introduce you to Dr. Hyun-Yuk Choi. She is an associate professor, and she's going to talk to us today about global environmental impact of what we eat. So welcome, Dr. Choi.
Well, thank you, Dean Witt, for that kind introduction. So I am an environmental epidemiologist, and my passion is to study what air pollution in a local scale does to a person when the person is exposed prenatally, very early on in life. But I thought I shift focus in this talk a little bit and talk about my passion and my sense of mission. Like why does this work mean so much to me? And when was it that this work started becoming personal, and when did I start seeing myself as problem solver? So I am not going to talk much about my research, but if you are interested, please, you're more than welcome to contact me directly, and I'd be very happy to engage with you about possible participation. Next slide, please. So when I think about the moment that this work started become personal is when I saw the pictures of all these factory farmed animals who were grown so quickly in cases of this one breed of chicken that they're completely unable to stand on their own feet. Their bones are too brittle and they are so heavy relative to the strength of their bones that they are, their bones just break. Sometimes they are so stressed out that they pluck their own feathers out and commit suicide. These pictures of young cattle, is housed in these individual cages, and they're not even able to move. And the person who showed me these pictures were this philosopher by the name of Peter Singer at Princeton University, who compelled all of us to think for the first time about the ethics of what we eat. There's actually a book by the same name, which I would encourage you to look up. So for me, this work is all about ultimately the action, translating empathy into an action to protect the people that you love. Otherwise, I mean, I couldn't agree more with Dr. Singer that the reason without emotion is unrelatable, is useless. Next slide, please. So even though this slide does not directly relate to my research, I mean, I'm becoming much more of a systems biologist in which I am beginning to look at the complex web of causal pathways ranging from our genomic molecular factors, including our transcriptome, epigenome, microbiome, ranging all the way to the air pollution level. But before, we get to that point, I just wanted to very briefly highlight, the sources of global emission of greenhouse gases from several very typical food items that we would consume, ranging on top from beef. These are the beef cattle, beef herd, raised in, somewhere in middle America, to lamb and muttons, to cheese, the dairy beef, and ranging all the way to nut. And nice thing about this figure is that it's broken down by the amount of the greenhouse gases that are emitted by each segment of the supply chain, ranging from land use, shown in green, to actual farming practices, what the actual animals or the fish or nut trees, for example, would produce in terms of the greenhouse gases, to animal feed, to shown in orange, to processing, to global transport, shown in red, and retail, shown in yellow, and packaging in gray. And you might have noticed already that, beef, out of all the items that are listed here, is just blowing everything else by the wayside in terms of the amount of the greenhouse gases that are emitted from it. So, what the choices that we make, what we do, understanding the sources of our action are all, important in what we study. So, that would be, this is just an example of what I might compel you to think about if you were to join my lab. So with that, I'm going to wrap, and thank you, Dr. Witt.
Thank you so much, Dr. Choi. I'm going to toot Dr. Choi's horn a bit. She is an internationally renowned environmental epidemiologist, and she didn't talk a lot about her research, but it is some of the most important research in air pollution really that's happening. She's she's doing work in the Czech Republic and in China. And one of the really exciting things is that she's actually going to explore the higher prevalence of respiratory illness in the Lehigh Valley. So we're so fortunate to have her expertise, and we're all excited to see what she's going to do. So thank you, Dr. Choi. Without further ado, I'd love to introduce Dr. Fatima Wakil. She's an associate professor, and she's going to talk to us about racial and ethnic disparities in maternal and child health. Dr. Wakil.
Hi, everyone. Thank you so much for the kind introduction, Dean Witt, and thank you all so much for joining us today. So I'm going to be speaking a little bit about my research, which focuses on maternal and child health and disparities in maternal and child health, and essentially ways to reduce these disparities. Next slide, please. Okay, so as you can see here, there are 3 graphs on the slide, and they all depict racial and ethnic differences in key maternal and child health outcomes in the US. And all of these data come from the Center for Disease Control and Prevention. So the graph on the top left shows that African-American women are actually 3 times more likely than white women to die as a result of pregnancy or its complications. Also, we can see that Native American and Alaska Native women are about 2.3 times more likely than white women to experience pregnancy-related deaths. And then when you look at the graph on the bottom left, you can see that these disparities are actually also transferred over to infants. So African-American infants are 2.3 times more likely to die in the first year of life when compared to white infants. And with Native American infants not falling far behind, Native American infants are almost 2 times more likely than white infants to die in their first year of life. And then finally, when you look at the graph on the right, you can see that non-Hispanic Black women in the US actually experience the similar or even worse maternal mortality rates when compared to women in lower income countries, such as Mexico and Uzbekistan. And then when you look at, and interestingly, when you look at the average mortality rate of white mothers in the US, it is actually still higher than women in many other developed nations, such as the UK, France, and Japan. So these are very startling statistics, extremely startling statistics, especially for a nation, and Dean Witt talked a little bit about this. So this is a nation that spends about 18% of our gross domestic product on healthcare, which is more than twice the average spent among developed nations. And so these statistics are still, these disparities are still occurring. And what's really more disturbing is that these maternal and child health disparities have actually persisted over time. They're not going away. Things don't seem to be getting better. And in some communities within the US, these disparities are only getting worse. So why do these racial and ethnic disparities in maternal and child health outcomes exist? That's the big question. Prior studies point to differentials in socioeconomic status, exposures to stressful life events and chronic stressors, access to health services, and other health promoting resources, and then risky health behaviors as possible explanations. So when I was doing my doctoral work back in the day, I started noticing that a lot of the research really focused a lot on risks that lead to these negative maternal and child health outcomes. So I decided to think a little outside the box and adopt a strength-based approach and examine the positive resources that women can actually draw upon to help achieve healthy pregnancy and birth outcomes. Next slide, please. So the big question that I ask myself all the time is, why is it that some women, despite all of the stressors and all of the challenges that they face in life, why is it that they still have healthy pregnancy and birth outcomes? What are the resources they have, and what does that toolkit look like? So in my work, I have coined the term personal capital to really embody this idea of maternal resilience. I've defined personal capital as a multidimensional set of internal resources and social resources that help women cope with or reduce their exposure to stress. And we know that stress before and during pregnancy has been shown to significantly increase women's likelihood of experiencing adverse pregnancy and birth outcomes. So as you can see on the figure on the left-hand side of the slide, I've conceptualized personal capital as including these internal resources at the individual level. But these are protective qualities that are inherent in each woman, such as self-esteem. And then social resources more at the interpersonal level. So things like partner support and that social network support And then finally, social resources at the community level. So components such as neighborhood support. So I was able to use data from a population-based survey in Los Angeles County to create this conceptually grounded construct of personal capital. And I then created a ratio, which you can see on the right-hand side, to embody the balance between stress and personal capital. And I found that in this data set that women who experience greater stress relative to personal capital were actually more likely to also experience certain pregnancy and birth outcomes, adverse pregnancy and birth outcomes. So this brings me to what I plan to do here alongside my students and my faculty colleagues here at Lehigh. I aim to expand my exploration of this concept of personal capital in two ways. First, I want to see or plan to better understand how personal capital looks different in different groups of women. Specifically, what are those culturally relevant components of personal capital that are germane to women in different various racial, ethnic, and socioeconomic status groups? And then second, I really want to understand, how does personal capital develop over the life course? Are there characteristics and resources we can promote through programs and policies and further research from early childhood, adolescence, and during pregnancy to help women achieve these healthy pregnancy and birth outcomes? And so this is where you all come in. I wholeheartedly invite students to join me on this exciting journey as we work together to conduct both quantitative analysis of large longitudinal data sets, as well as more qualitative community-based research to help answer these important questions. And I also want to do a quick shout out to some of the other research I'm doing, which is not on the slide. But in addition to my maternal and child health research, I'm actually currently working on a multi-phase study regarding COVID-19. So the first phase of the study, which I'm working on right now, is really to explore the perceptions of Lehigh Valley community leadership regarding the COVID-19 pandemic. This is a qualitative study. And so basically what I'm doing is conducting informant interviews via Zoom with different leadership from different community stakeholders to really understand what are the needs in our Lehigh Valley community regarding the pandemic. The next phase is really to interface with other faculty across Lehigh and come together and do this interdisciplinary phase 2, which will be developing a survey for community residents in Lehigh Valley to understand what their needs and perceptions are regarding COVID-19. And in the fall, which is where I hope all of you, some of you might be able to help me out with, is phase 3, which is to conduct a national study of the impact of COVID-19. So I really look forward to having some students join our study team. You're going to get firsthand exposure and engagement with this type of research. And finally, I look forward to working with all of you in the fall in my Introduction to Population Health course that I'll be teaching, that all of you hopefully will be taking. Thank you.
Thank you so much, Dr. Wakil. I've got to give her a shout out. She is really an expert, the world's expert in personal capital and really thinking about women's health. The kinds of innovative, theoretically based studies that she's conducted have really changed the way that we think about supporting women and getting them the resources that they need during their reproductive age, so that they go into pregnancy with the best health capital. So and I really applaud your generous spirit, and really the generous spirit of everyone on the faculty in wanting to do research here in the community. We want to give back. We want to be here to support the Lehigh Valley and the state of Pennsylvania. And so, the faculty have been great in using this as an opportunity for us to support the community and helping us get through this and understand what the needs are. So thank you, Dr. Wakil. Really appreciate it. So now, join our College of Health family. We're going to talk about key differentiators. Is it subtle? Join the College of Health team and go Mountain Hogs. But really, we want to explain to you why Lehigh's College of Health is really different and unique. And one of the some of the considerations that you might want to think about as differentiators. Next slide. So before we get started, I wanted to share a few quotes from your fellow students, your cohort. So Maxwell Lee is from Delaware, and he visited Lehigh and met with us. And the reason he chose the College of Health is, he had, had a professor who had dengue fever, and saw how that affected her, and was able to essentially think about how can we use data and lab work to make sense of this disease. So what drew him to population health was really the urge to want to learn more about data science and how to come up with solutions to reduce the effects of devastating diseases like dengue fever in areas that that can't typically afford to get health care. And then I want to introduce you to another classmate of yours. Next slide. Ainsley Dom Bosh. And she chose Lehigh's College of Health, because she's very interested in sort of the psychological aspects of health, and she really would like to combine high-level academics and her passion for health through athletics with education, and take a deeper dive into population health. So so she's also a fellow student of yours. So the cohort is growing and growing, and we are so excited about the incoming class, and just so many of you are contacting us and so excited and engaged. So we really, really appreciate it. So let's talk about what makes Lehigh's College of Health unique. We are the world's first institution to offer an undergraduate degree in population health with a focus on health innovation and technology. There are no universities in the world who are doing this at the undergraduate level. And that's really important because most of that training happens at the graduate level. There is a movement to go upstream and think about, and that's why we developed this undergraduate program to meet the needs of data science and health. So, we are the first to develop this degree, so we're very proud of that. And in that vein, we also will establish a Department of Health Innovation and Technology. And why is that important? It's important because we are intentionally saying that health innovation and technology, as it relates to population health, is a evolving and very important piece of understanding health outcomes and how to improve health outcomes. And so we really wanted to be intentional about that. And so students will actually be able to concentrate on health innovation and technology starting in their junior year. And they can spend 2 years really taking a deep dive into things like, virtual reality, machine learning, natural language processing, thinking about health innovation in resource limited settings. So, you'll really, I think, really enjoy that opportunity. And then I would say that, we are really, really strong in experiential learning and real world experiences. It's really baked into the DNA of Lehigh University. And so it's baked into our curriculum. And we really believe that that's critical for, when you graduate, to be marketable and really have a leg up, because you will have worked alongside some of these amazing faculty we heard from today. You could be collaborating with one of our partners. You could, develop a project that led to a patent. There's so many things, I think, in terms of the experiences that you will have in the College of Health that make it just a very exciting place to be, because there's something always happening. There's a buzz. And so I can't express that enough, that, you'll be coming out of this program with real world experience. And I can tell you, I've been talking with employers as we develop this curriculum, what are some of the skills that you need? And they really are looking for people who have some experience applying what they've learned. I mean, and who are professionals, and people they don't have to train straight out of the gate. So that, I think we really, in the spirit of Lehigh's strengths, we really do offer that kind of environment, and encourage it, and encourage the students' imagination about what an experiential learning opportunity might look like. Maybe it's an internship, maybe it's writing a paper with a faculty member, maybe it's going and giving a presentation somewhere. So I think that'll really be great. Next slide, please. So we actually have quite a large imprint globally already. There are plentiful research opportunities, certainly here within the United States. And we also have a number of different international partners who have expressed a lot of interest in the students who we will be training in data science and health. So there's a lot of possibility there. You're gonna, as you heard, you're gonna get active mentorship from the faculty. These faculty are committed to undergraduate education. A lot of us were at the graduate level, and when I became dean, I really felt like this is so important to be able to bring this information, this life-saving information, into the undergraduate realm, because you all can do this stuff. You're very smart, and especially with the technology piece and bringing that in, and there's such a need for population health scientists right now. So there are, just lots of opportunities, for you to get out there and have a very great career. There's going to be, the class of 2024 will also, what's interesting, really shape the path of the college. So we're growing together, and one of the things that's, I think, incredibly exciting about you and this cohort is that we're in this journey together. We've developed the curriculum, but some of it we have to be agile, and we have to be nimble to sort of stay, current with some of the innovations and technologies that are developed in health and healthcare. And then I think also, in dissemination of information, you all know more about social media platforms, and the power of using that to improve health, I think, is so untapped from an official source, someone who is a professional in health and healthcare. So I think there's a real opportunity there too. So you really, you're a special group of students, and I think ones that are really going to be leaders in the field. Population health is a new science. It's a convergent science. That's one thing that makes it so exciting, is that it's changing, and these students who are trained, you know, at the early age, you know, of undergrad, are really going to change the direction of this field. So I think that's pretty exciting and compelling. A compelling reason I think to come here is, you know, we're going to be teaching you. We're experts in population health and data science, but we're going to be learning things from you too. We're going to be learning about, you know, how you guys communicate, and you know, how you know, what are the best technologies for disseminating you know, critical information and emergency level information. What do people, you know, that kind of thing. I mean, we're going to be learning a lot from you, and your own experiences that you bring with you to college, I think also is very, very important. The other thing that I think that makes Lehigh very unique is that we've designed the Bachelor's of Science program so that you can continue on with postgraduate education, you know, either here at Lehigh or at a partner institution. We are actually exploring an opportunity for a BS MD program. And by next year, we'll be offering a Master's of Public Health degree. We've been discussing among the faculty about a 4-1 program. So a BS student could get a master's degree in 1 year. So all of this is to be decided, but there are a lot of, I think, opportunities to continue your education, whether it's going to medical school or possibly, you know, staying here and getting a master's degree in public health or in population health. We want to be your intellectual home. We want to be the place that you know what you're getting. You know that the quality of the education, you know, the people, you know, and their expertise, and we want, you know, to see you all the way through your career. So, and see us as a resource. So with that, I think, you know, again, I just would like to thank our panelists, and I also would like to thank Jeannie Cassis and Sherry Booth, and also Steve. And we also have 2 more faculty members joining us, actually 3, joining us this summer. And I just wanted to point them out here. Christine Daly, she's a medical anthropologist, and she does a lot of very interesting work on Native American health. And the other person who's joining us is Sean Daly. He's going to serve as a professor of practice. He is a social cultural anthropologist. So he really looks at the social and cultural factors that affect health, and using qualitative research methods. And then Tom McAndrew will be joining us. He's a biostatistician, and he actually does a lot of modeling on COVID-19. So he works directly with the CDC, and so he's a great addition to the team. So I would love to open it up for questions. Please type your questions into the Q&A feature. We are all on the line, and we are yours. So please use that Q&A and ask us anything. You can ask us anything.
And I will be monitoring the Q&A and providing, moderating that. It feels a little bit like an NPR telethon sometimes, doesn't it? We get on and get everybody participating here. But we've had a lot of great questions in the past, and we're looking forward to answering any outstanding questions you might have here about the courses, about the research we're doing, about the program in general, about Bethlehem and the Lehigh Valley. We've got more experience with the research and the courses than we do about the Lehigh Valley, Bethlehem area, since we're all relatively new to the area. But I think one thing that would be important to just expand on a little bit that we've had a lot of questions about that Dean Witt has mentioned is the emphasis on experiential learning and education. And we mean it when we say that you're going to be working alongside of us and all of us. And Dean Witt, I don't know if you want to delve back into that a little bit more, but we have Mountaintop Summer Institute, the Center for Creative Inquiry. All of the faculty are involved in projects there, and in our own sort of ongoing efforts. We'd be happy to communicate with you over the summer and see if we can get you involved in some of our work even before you're official. So.
Yeah, I totally agree, Dr. Skinner. There are many university-wide opportunities for students to engage with a variety of different professors, different leaders on campus. And because I would say that Lehigh is really, very strong in experiential learning. And so they've developed these different programs to promote that and to continue that. So as Dr. Skinner mentioned, that's certainly a resource for you as you go forward. And so I think, do any of the other panelists have things they want to share with our incoming class? Anybody want to say anything before we close?
I'd just like to add to what Dr. Skinner and Dr. Dean Witt have said, and to clarify that I have ongoing projects in Czech Republic. We're looking at the air quality and reproductive outcome in both men and women and children. We have, a host of several cohort studies looking at series of developmental outcomes in Czech Republic as well. We have several projects in China where we're looking at the air quality issues and a whole host of outcomes. And there's really nothing quite like, being there, and then you confront, you get confronted with reality, For example, whenever I presented my data in international conferences, I used to have these US scientists who would walk up to me and say, I think you have an error in your number. This numbers could not be real. This is just too high. Air quality, this could not be this bad. And that it really is because we're thinking within the frame of US air quality, whereas the reality of air quality in some of these other countries are vastly different. So we want you to go out there, confront the reality as is, and think of yourselves as the problem solvers.
Yeah, I just want to build on that a little bit. Thank you for that. One of the things that I think you'll get here that you won't get at other schools too is really, to Dr. Choi's point, you're really going to learn about some of the sort of emotional intelligence pieces of what it means to be a leader, a professional. Some of the things that people don't get taught but are so incredibly important for work, and really encouraging them to spread their wings there and think broadly about. We'll be teaching them about ethics and the kinds of products that where our research comes out, peer-reviewed journals, blogs, you know, white papers. So they'll learn about that as well. So it's exciting. It's an exciting time because I think we have a chance to shape population health, and you guys are amazing. The students we've interacted with so far are just incredible, and I'm already just blown away with your passion and with your knowledge of population health. So with that, I'd like to just say I hope you choose Lehigh. We'd love to have you, and thank you so much for your time and for thinking about Lehigh and considering us. And with that, I think we'll close the webinar. Bye, everybody.